To the Massachusetts healthcare community, to the doctors, nurses, technicians, specialists of all sorts, and every person who reports to work in a healthcare setting, thank you on behalf of the people of the Commonwealth of Massachusetts. You're working in wildly challenging and difficult times and circumstances. What we announced today will hopefully allow you to serve your patients more effectively. The Massachusetts National Guard is also due a tremendous thank you. From getting kids to school to protecting small businesses to now helping our healthcare providers, these citizen soldiers answer every call. The jobs and commitments they leave to serve us are real, and we're deeply grateful for it. There's no question the next few weeks will be enormously difficult for our healthcare community. There are staff shortages, sicker patients, and fewer step-down beds available, again, because of those staff shortages. The steps we're announcing today are designed to support them so that they can continue to care for patients. We also know there's some anxiety out there with talk of rising cases, breakthrough cases, and variants. Throughout the course of this pandemic, there's been no shortage of hypotheticals, no shortage of worst-case scenarios to be debated, and no shortage of things we don't yet know the answer to. And it's very easy to get lost in all that. It's also easy to get anxious about all that. But it's critically important that we also remember what we do know for sure. We know that kids are at extremely low risk, and we know that going to school is safe, and in many cases, it's also healthy for children to be with each other and with trained, caring adults. We know vaccines work. We know that out of the 5 million people in Massachusetts who are fully vaccinated, only 2% have gotten COVID. We know that among all the breakthrough cases in Massachusetts, 97% of them never end up in a hospital. And we know that of the 1.2 million people over the age of 12 and under the age of 30 who've got vaccinated, not one has died from COVID. We know that of the nearly 2.5 million people under the age of 60, less than 1% of these people, in fact, 0.1% of them have died from COVID. And we know for those over 60 who got vaccinated, less than 3% of them have died from COVID. And we also know that almost 2 million people in Massachusetts have already received a third dose. We also know that unvaccinated people are 31 times more likely to just test positive than someone with that third dose. We also know that the vast majority of the people in the hospital with COVID are not vaccinated. All that means, among other things, is that we know for sure that vaccines offer tremendous protection from illness, better than any other measure. We also know testing works. Rapid at-home tests taken before you get together with people outside your household can prevent transmission. They offer a little more peace of mind this holiday season too. And the hundreds of testing sites around the state can do the same. We also know wearing a mask can help. If people want to take an extra step, everyone knows they can put on a mask in a crowded indoor place. We updated the face covering advisory today to urge all residents to wear a mask in public indoor spaces. We'll continue to release the best public health directives we have so people can make informed decisions about how to protect themselves. Obviously, our administration will continue to support cities and towns and businesses that adopt additional protocols. Vaccines and all the other resources we now have available and know for certain that they work are far more important than any hypothetical question that we may not yet know the answer to. For the foreseeable future, Massachusetts and most of the country will see large numbers of new cases. But a new case today does not mean the same thing a new case meant a year ago. The therapies and vaccines that offer near universal protection did not exist a year ago. Vaccinated people may test positive, but their chances of dying or getting seriously ill are so small they pale in comparison to so many riskier behaviors out there. We should not lose sight of this. Yes, cases may go up, but if you're vaccinated, your risk stays the same. That is extremely low. And if you're boosted, your risk of getting sick is even lower. The holiday season is here, and opportunities to share special moments with people we love are also here. The people of Massachusetts sacrificed those moments when hunkering down was truly our only defense. That's no longer the case, thanks to the protection afforded to all of us by vaccines. Getting vaccinated and getting a booster, if you're eligible, is the best thing you can do this holiday season for you and your family. Doing so will help you and your friends and family because it is the single best thing you can do to support yourself, your family, and our healthcare providers. We distributed over 2 million free rapid tests for people here in the Commonwealth in many of the communities hardest hit by COVID. Those tests are also available at retail, at your local pharmacy, at many other locations, and you can also purchase them online. Use them before you get together with friends and others. Let me say that again. You can buy a cheap do-it-yourself test at CVS, Walgreens, Walmart, or online, and use those tests before you get together with others in big groups. In addition to at-home tests, our testing sites in Massachusetts continue to be available and are very busy, delivering over 100,000 tests a day for the past several weeks. The testing tools, vaccinations, and many of the other tools we have make it possible for people to gather safely. We just need to use them and use them appropriately. It's no secret that all the time we spent away from family and away from friends and away from the classroom had a negative impact on some of us. But back then, it really was our only defense. The Commonwealth is home to strong and intelligent people, but no one is immune to the anxiety and the mental health struggles that have been brought on by all this isolation and loss of physical presence that has come with the pandemic. Please, if you're struggling, reach out to a friend or a family member or reach out to a healthcare provider. If you know someone who you think may be struggling, reach out to them. They are sure to appreciate it. And please get your information about COVID from a trusted source like your doctor or a medical institution or the Department of Public Health or your local Board of Health. And to all of the people in Massachusetts who have done their jobs throughout the course of this pandemic, we need you to do another one, to be there for your friends and your family and to offer a helping hand through the course of this holiday season. People are anxious. That's normal given everything we've been through. But what we know about this virus, what we know about how to protect ourselves, and what we know about the character of the people in Massachusetts should give us all cause for pause and a sense of relief. Thanks to so many people, Massachusetts is one of the most highly vaccinated states in the country, and the evidence is overwhelming that these shots work. We've made tremendous progress by doing the things that Massachusetts knows well, following the data, looking out for one another, supporting one another, and being there for family and friends. That game plan is working, and we should stay with it.